on, Doc.
Come in.
Hello, how are you? My name is Janelle. I'll be your nurse today. Wash my hands. So my name is Janelle. I'll be your nurse today. Can you tell me your name and date of birth, please?
Bonnie McCray, January 9th, 1949.
Okay, thank you. So I'm gonna pull this curtain for privacy. So Miss McCray, today I'm just going to do your physical assessment, listen to your heart and lungs, and just make sure everything sounds good. And you can voice to me any concerns that you have. Okay, so we're just gonna do a follow up today.
Okay.
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 So make sure your bed is locked for safety. So how you doing today, Miss McCray?
I'm doing good.
You're looking pretty good.
Thank you.
Me. Get some more hand sanitizer. Okay. So did you just get your hair done? Because that looks nice.
No.
No?
No.
Your clothes look good.
Thank you.
You smell good. Is that, what kind of perfume is that?
What is it? Amber Romance.
Ooh, that sounds good. Did one of your children buy it for you?
No, I bought it myself.
Okay, excuse me. Okay. So, Miss McCray, today we are going to start off with your cranial nerves, okay?
Okay.
All right. So I'll be assessing cranial nerve number 1. So I just want to ask you if you can smell this hand sanitizer, okay?
Yes.
Okay. So then I'm going to do your cranial nerve number 2, and I just want you to read this. Can you read my badge? Can you tell me what that says?
Delaware College, Janae student.
All right, thank you. Okay, so now I'm going to assess your cranial nerves 3, 4, and 6, and I'm just going to look at your eyes and your pupils. Just see what size your pupils are, see if they accommodate. So I'm just going to have you do a couple things, okay?
Okay.
All right. I'm just going to look at your pupil size here. So looking at my pen light, you have a pupil size of 2, okay? So if you can just do me a favor. All right. If you can just do me a favor and look here at my pen light. And then look right back at that wall. So look here and then look straight back. All right, good. So I'm just looking to see if your pupils accommodate, which they do. Okay. So if you can just look here for me again. I'm just going to do my pen in an 8 shape, okay? And just follow it. Okay, good. So, your pupils are reactive to, your pupils are equal, round, and reactive to light and accommodation. So that's good. I'm just going to look at the sclera around your eye. So that's just the white area around your eye. Just looking to check if you have any drainage or if they're discolored, and they aren't. So they look pretty good. Do you have any problems with your eyes?
Yes.
You do? Mm-hmm. Can you explain to me what kind of problems you have?
I can't see.
You can't see. Okay, is that more at night, during the day?
Both day and night.
Both day and night.
Mm-hmm.
Okay, so you just have some problems with seeing.
Yes.
All right. Do your glasses help?
Yes.
Okay. All right, good. So now I'm going to assess your cranial nerves 5 and 7. So can you just tell me where I'm touching on your face?
On my left side of my face.
Okay, can you tell me where I'm touching here?
Right side.
All right, can you smile for me? Can you frown for me? Can you puff your cheeks? Can you clench your teeth? Okay, good. So I'm just checking for the symmetry of your face. So I'm making sure both sides are equal and they're symmetric. Okay. So now I'm going to assess cranial nerve number 8. So can you tell me if you can hear this?
Yes.
Can you hear here?
Yes.
All right, good. So I'm going to assess cranial nerve number 9 and 10. So can you do me a favor and say, ah?
Ah.
Okay, so I'm just going to take a look into your mouth. Make sure you don't have any sores or anything in your mouth and nice and red. You don't have any thrush on your tongue. And I'm just going to look at the little thing that dangles in the back of your throat, and that's called your uvula. And I just want to make sure that's intact as well. All right, so you have some nice teeth, Miss McCray. Looks like you take care of them. That's great.
Thank you.
Did you ever wear braces?
No.
No? Okay, good. All right, Miss McCray, I'm going to assess cranial nerve number 11. So if I just need you, do you have any problems with your back or anything?
No.
Okay, can you just can you just shrug like this and push up on my hands? Nice and strong, great. Okay, good. So I just want to, if you can sit up for me. Just want to take my fingers down your spine. Okay, it's nice and straight. You don't have any problems with your spine, do you? You have any issues with your back?
No, just my lower back. Lower
Okay.
part of my body.
Are you having any pain right now?
No.
No? Okay, good. So my last cranial nerve I'm going to assess is cranial nerve number 11. So I just need you to stick your tongue out for me and move it from side to side. Perfect. So good. Your cranial nerves are intact, 1 through 12. So that's great. So, Miss McCray, I gave you a Glasgow Coma scale of 15. We do that to assess your level of consciousness. So when you look at me, you have your eyes open. When you talk to me, when you follow my commands. So I give you a 4 for eye opening. I give you a 5 for verbal response, and I give you a 6 for your motor response. Okay, so that's the perfect score of 15. Okay. All right, so I'm just gonna feel your head for any lesions. Make sure you don't have anything in your head, or make sure you don't have any lumps or bumps. Does your head feel okay? Does this hurt at all?
No, my head don't hurt.
Pressure there. Okay, good. So I'm just gonna feel your glands. You have any soreness there?
No.
I don't feel any lumps or anything. So that's a good sign. Okay, so I'm just going to take my pen light and I'm going to assess your ears. So make sure you don't have any drainage coming out of your ears. Great. You don't have any wax. That looks good. And I assess your mouth. So I'm just going to look up in your nose. I know it might be a little uncomfortable. So make sure you don't have any drainage or any bumps in your nose. Make sure that's intact, and that looks great. Okay. Okay, Miss McCray, I'm going to take a look at your arms and your skin. You have really good skin. What kind of lotion do you use?
Any kind.
Okay, you have a little scar right here. What happened there?
I fell.
Okay, well, I'm glad you're okay. You have really good skin. So I'm just going to assess your fingernails for cap refill. Just making sure you have circulation. That's good. So it's less than 2, which we like. Can you move your fingers for me? Good. Can you lift your arms? Do you have any pain when you lift your arms?
No.
No? Okay, good. All right, Miss McCray, what I'm going to do is I'm going to listen to your heart and your lungs, okay?
Okay.
So if you could just take a deep breath for me. Good. Deep breath. Deep breath. Deep breath. Great. Okay. If you could just sit up for me, we do the same thing around the back. Deep breath. Going in a zigzag pattern across your posterior part of your back. Okay. Ms. McCray, do you have any problems with your lungs? I hear just a little bit of roncon. Sounds like a little... Yeah, okay. All right. I'll listen to your heart, okay?
Okay.
You have any problems with your heart?
No.
No? Okay, good. So I'm just going to do my landmarks right here and listen to the aortic. Good. Pulmonic. Tricuspid. And your mitral, which is in your 5th intercostal space. And I'm going to listen to your mitral. Or sorry, 5th intercostal space, midclavicular line. Mitral. Tricuspid. Pulmonic. And your aortic valve. Okay, Mrs. McCray. Oh, I'm sorry. So looking at your stomach, I don't see any abdominal distension. Do you have any problems with your bowels at all? Or any problems with your stomach?
No.
Okay, can you tell me when was the last time you had a bowel movement?
Today?
Okay, do you have any problems when you urinate? Does it sting? Does it burn?
No.
No. Do you have any problem with your genital area or your rectum area?
No.
No. Okay, so I'm just going to take a listen to your bowel sounds just to see if they're nice and normal, okay?
Okay.
All right. Nice and active. Okay, I'm just going to flip this over and listen to something that we call brewery. And brewery will detect to see if there is an aneurysm present. And that's normal, so that's good. Okay, Mrs. McCray, so I'm just going to take my fingers and I'm just going to feel around your belly a little bit. Let me know if it's too much pressure and if you have any pain there, okay?
Okay.
Everything feel okay?
That's fine.
All right, good. You haven't had any surgeries or anything that have to do with your stomach, right?
In years.
Did you have a hysterectomy, or not a hysterectomy? Did you have a C-section or a hysterectomy or anything?
Hysterectomy.
Okay. Any C-sections?
No.
No, that's good. When did you have a hysterectomy?
Back 30 years ago.
Okay. You still have the incision there?
Yeah.
Okay. All right. Okay, Mrs. McCray, so I'm just going to assess your legs. Yeah, really pretty legs. You take really good care of your skin. I do see some marks here. What happened there?
I fell.
Oh, man, you do a lot of falling. Are you falling because you're unsteady, or it has anything to do with medication or
I
anything?
fell on the job. That was years ago.
Oh, okay, just
In
an
a drain.
accident. Okay. All right, Mr. McCray. So can you just lift your leg for me? Good. Can you lift your other leg for me? All right. Can you push against my hands? Awesome. So I'm just going to take your legs and bend them back. Can you tell me if you have any pain in your hips?
No.
No, that's good. Good. All right, so I'm just going to also take this leg here. So I'm just going to assess to see if you have any DVTs, and that's called a deep vein thrombosis. And that's just like a clot in your lower leg.
Okay.
Okay. So I'm just going to, you can bend your leg for me. I'm just going to push up here. Do you have any pain in your, down here, in your lower legs and your calves? Good. I'm do the same for this foot. Okay, great. All right, so I'm just going to assess your pulses in 3 areas. So I'm going to assess your pulses here, which we call the dorsalis pedis pulses. Good. They're nice and strong and equal. Here's your tibial pulses. Nice, strong, and equal. And then here in the back of your knees, we call these your popliteal pulses. Okay, good. Nice and equal. So I'm just going to check here for any, check around your heels. Make sure you don't have any opening or any sores or anything. So these look really good. You take really good care of your feet. A lot of times if you have any openings in your feet or anything, that can lead to an infection. Again, that's what we do not want. Okay. So I'm checking your cat refill on your toes. Your feet look good. Okay. That's good, Mrs. McCray. Mrs. McCray, I do have a couple questions for you. So how are you? Do you get a lot of family, a lot of company? Or do you have a lot of family around you?
No.
You don't? But do you have any things that you would like to tell me? How are you feeling?
No. I'm feeling fine.
You feeling good? Are you happy and content?
Yes, I am.
Awesome. Okay.
Yes.
So do you have any questions for me?
No, you did an awesome job.
All right. Well, thank you so much, Mr. McCray.
Thank you.
Are you having any pain anywhere?
No.
Okay. So I'm just going to lock your bed.
Okay.
Make sure you have your call bell on reach, okay? If you need anything, you just ring your call bell and we'll come right in and assist you, okay?
Okay, thank you.
All right. Dinner should be coming at about 7, okay?
Okay.
All right.
You have a good night.
You too. I'll take my gloves off, put them in the trash, wash my hands, and my patient is safe. Would you like the light off?
No, thank you.
Okay.